Somewhere between the years 2010 and 2017, roughly 100 million Americans became patients without their bodies changing at all. Not one new symptom, not one lab value that shifted overnight. What changed was something much simpler. A committee in a meeting room moved a number on a page. I want to walk you through exactly what happened, because I think every one of you deserves to understand it before your next appointment. Not to make you distrust medicine, but so you can ask better questions inside it. Before we go further, this video is educational, not a replacement for your own doctor's advice. If you've been diagnosed with any of the conditions I'm about to discuss, please don't change or stop anything based on this video alone. Bring these questions to your own physician. That conversation is where this information actually becomes useful. Let's start with blood pressure. For decades, 140/90 was the line for high blood pressure. Then, in November 2017, a cardiology panel redrew that line to 130/80. Same people, same readings. But overnight, an estimated 31 million additional Americans were reclassified as hypertensive. What's worth noting is that several other countries, the UK, much of Europe, Canada, looked at the same underlying evidence and chose to keep their threshold where it was. Same data, different conclusion. That alone tells you this isn't pure biology. It's also judgment. Next, cholesterol. The normal LDL threshold has been revised downward more than once since the late 1980s. Each time it dropped, the pool of people eligible for a statin prescription expanded with it. To be clear, statins are genuinely valuable medications for many people at real cardiovascular risk. The question isn't whether statins work. It's whether every person newly captured by a lower threshold has the same level of risk as the person the original guideline was written for. And then there's prediabetes, a category that essentially didn't exist in its current form until relatively recently. When the diagnostic threshold was lowered, tens of millions of adults were placed into this category in a single policy update. Here's my honest question, and it's the same one Dr. H. Gilbert Welch raises in his book, Overdiagnosed. Does moving a number on a chart actually change someone's health outcome? Or does it just change how many people are now formally sick, and how many prescriptions follow? This isn't fringe thinking, by the way. The British Medical Journal has run an ongoing editorial series called Too Much Medicine for years, specifically examining this pattern across multiple conditions. This is a live, respected debate inside mainstream medicine, not outside it. So if the diagnosis is partly a moving target, what actually matters? I'd argue it's the biology underneath all three of these conditions. And for a lot of people, that shared biology is chronic insulin elevation. Chronically elevated insulin is associated with stiffer arteries, with unfavorable cholesterol patterns, and, obviously, with rising blood sugar. It's frequently driven by a diet consistently high in refined carbohydrates and added sugar. Think of your body like a fish tank. You can treat every fish for every individual symptom, but if the water itself is the problem, nothing fully recovers until you address the water. For a lot of people, insulin resistance is the water. I want to be careful here because this is the part people often oversimplify. There is real research behind several lifestyle approaches that support healthier insulin and blood pressure levels. A reduced carbohydrate eating pattern, regular movement and exercise, the DASH dietary pattern alongside lower sodium and adequate potassium intake, magnesium-rich foods, and in some studies, specific compounds like hibiscus tea and garlic have shown modest blood pressure lowering effects. A quick, important note, some natural compounds, like red yeast rice or high-dose niacin, which are sometimes discussed for cholesterol, can have real interactions with other medications and real side effects of their own. These aren't no-risk alternatives. They belong in a conversation with your doctor or pharmacist, not a self-directed swap. What the research is genuinely strong on is this: these lifestyle factors work best stacked together. Diet, movement, sleep, and stress management combined, rather than any single item in isolation. Here's what I want you to take from today: not fear, but a better question. The next time a number on a lab report changes your diagnosis, it's fair to ask your doctor, "What changed in my body?" Or, "Did the definition change?" Both answers are useful. Only one of them is about you specifically. You deserve to be an informed partner in your own care, not just a name on a chart. That's what this channel is here for. If this helped you see something differently, subscribe. Next week, I'm breaking down exactly how insulin resistance develops step by step and the specific signs your body gives you long before any diagnosis does. Take care of yourself. I'll see you in the next one.